Hi everyone, this is Dr. Merhaut. I'm here with Dr. Keklak. Today with our Elite Education series, we're going to be talking about some of the soft tissue work that we do in the office. Some people don't realize as chiropractors we do more than just adjusting, so I'm going to demonstrate some of the things that we do to help aid in the adjustment and also to make the adjustment last a little bit longer. So some of those things are going to be some trigger point therapy, some active releases on some muscles, passive releases, as well as some different stretching techniques that we also use on a couple muscles. We're going to be focusing on the upper neck area today just for simplicity purposes. Plus, I see this every day and it's almost something I do every day on a lot of patients. So to start out, we're going to be doing some trigger point therapy on Dr. Keklak. So to get started with that, we use some type of an emollient. It's just a little bit of a lotion so we don't really give the skin a rug burn in any way. With Dr. Keklak, he has a couple trigger points in the upper trap. Most people have something along those lines within the upper trap or the levator scapula themselves. So with the trigger point therapy, it's simply just finding the trigger point itself, which feels like a balled up muscle tissue. So some people, when they talk about having knots in their back, that's what they're talking about, is those trigger points. So simply just finding the trigger point and pressing into it, explaining to the patient to have them just take deep breaths in, all the way in and all the way out. As I'm pressing in, I can feel the trigger point itself just unravel itself as I'm doing the constant pressure. It's also considered, more of the medical term, ischemic compression. Did I freeze? Oh no, I didn't. I thought I froze. So that is trigger point therapy with those spots. Sometimes people can have referral pain from the trigger point. So if he has a trigger point in his upper trap, he can sometimes have the pain all the way up into the base of the skull, or that can even be a source of a headache. So just by pressing into that trigger point itself, sometimes it can refer that pain up into that spot, and that gives me an indication on is that really causing his headache, or is it just a localized trigger point that needs to be released. So then we'll move on to a passive release, which is basically just me taking my thumbs and pressing through the muscle that's tense through that area. And it's passive because he's not doing any work with it. I'm just strictly moving my thumbs over the muscle, finding the tense areas, applying a little bit more pressure in those tense spots to help release that muscle. And then to intensify this, we can do what we call an active release, where the patient is going to be moving their head as I'm applying that same pressure I did with the passive release. So with this one, I'm going to have him turn his head to the right, and then he's going to drop his chin as I'm applying pressure down. So he's going to look forward first. I'm going to apply that pressure down as he's turning and dropping the chin. And oftentimes I can feel underneath my thumbs, trigger points, kind of like speed bumps going over. And the more I do the active release, the less those trigger points are prominent underneath my thumbs. So those are three real quick examples of muscle releases that we'll do. I'm going to have Dr. Keklak lie on his back, face up, and I'm going to show a couple stretches that we'll also do, both a passive stretch as well as an active stretch. So the passive stretch would, to that same area that we were just treating, would be just bringing his head over to the side and then me pressing down into his shoulder and then holding that for about 8 to 10 seconds until I feel it releasing a little bit. The active stretch, which is also called a PIR or a post-isometric release, it's called that because he's going to be doing an isometric hold where he's going to be pressing his shoulder up into my hand as I resist downward, and then so we'll have him press up into my hand. As he's pressing, I'm giving the resistance back so his shoulder is not moving, and then I'm going to have him relax. And as he relaxes, I'm going to take that shoulder down further into more of a stretch, and then I'm going to have him press again as the isometric hold, and then he's going to relax again, and I can go deeper into that stretch and continue to do that. And there are different ways to do that for all different muscle groups throughout the body. So if we're trying to do some type of muscle work, whether it's a release or a stretch, there are different ways to do that. Sometimes we base that treatment on what's more comfortable for the patient. Sometimes the active release is a little bit intense, or the post-isometric release can be intense. So we start out with something a little bit lighter, whether it's trigger point therapy or a passive release or just a passive stretch. So those are things that we commonly do for all different kinds of muscle conditions and muscle issues through the office. We see them correlating with subluxation, and that's why we're doing the adjustment. And then we incorporate the soft tissue work to enhance the treatment plan. Then we've talked about before also adding different types of exercises to strengthen those areas, but that's another lecture for another time. This is the Elite Education series. We talked about muscle therapy today. If you have any questions on any of those things or think that something along those lines can help you with anything that you're dealing with, feel free to share this with somebody else, or feel free to contact us and we can see if we can help you out. I hope you join us again next week for the Elite Education series.